the worst diseases of kings and queens of the Middle Ages and other times. Filth was a fact of life for all classes in the Middle Ages. Towns and cities were filthy, the streets open sewers, there was no running water, and knowledge of hygiene was non-existent. Dung, garbage, and animal carcasses were thrown into rivers and ditches, poisoning the water in the neighboring areas. Fleas, rats, and mice flourished in these conditions. Indeed, this was the perfect environment for the spread of infectious disease and plague. The Black Death was to kill over half of England's population between 1348 and 1350. As there was no knowledge of germs or how diseases spread in the Middle Ages, the Church explained away illness as divine retribution for leading a sinful life. Common diseases in the Middle Ages included dysentery, tuberculosis, arthritis, and sweating sickness. Infant mortality was high and childbirth was risky for both mother and child. Rushes and grasses used as floor coverings presented a very real hygiene problem. Whilst the top layer might be replaced, the base level was often left to fester. A lack of hygiene amongst medieval people led to horrific skin complaints. Poor people washed in cold water, without soap, so this did little to prevent infection. The more disfiguring skin diseases were generally classed as leprosy, and indeed leprosy, caused by the bacterium Mycobacterium leprae, can arise from dirty conditions. It attacks and destroys the extremities of the body, particularly the toes and fingers, and sometimes the nose. Leprosy was not the only disease that could affect someone in this way. The affliction known as St. Anthony's fire could also lead to gangrene and convulsions. This condition was caused by a fungus, ergot, that grows on rye. When the grain was ground to make bread, people who ate the bread became poisoned. Sexually transmitted diseases such as syphilis were common among all social classes. Symptoms included unsightly skin rashes, recurring bouts of fever, blindness, mental illness, and ultimately, death. Whilst the poor had to make do with traditional herbal remedies and superstition to cure their ailments, the rich could afford to pay physicians. Employing a physician did not, however, ensure that the patient would recover. The success of any treatment was largely down to luck. Indeed, many of the cures appear quite bizarre to us today. It was quite widely believed that the body had 4 humors, and if these became unbalanced, you became ill. A patient's urine was used to determine whether there was indeed an unbalance. Bleeding, sweating, and induced vomiting were the remedies of choice to rebalance the humors. Even the princely sport of jousting was not without its dangers, and not just broken limbs. For example, King Henry IV is believed to have suffered from seizures, perhaps as a consequence of repeated blows to the head received whilst jousting in his youth. Crusading could also be bad for your health. Wounds, infections, disease, and broken bones were just some of the hazards to be faced in the Holy Land. Should an unfortunate patient require an operation or amputation, this would be carried out by a surgeon, often a butcher or barber by trade, and would be performed without anesthetic. As the instruments were not sterilized, post-operative infections were often fatal. A reminder of the horrors of medieval surgery survives to this day. The red and white barber's pole traditionally found outside a barber's shop dates back to the Middle Ages. Its red stripe represents the blood spilled, and the white stripe, the bandages used during an operation. Historically, great harms were caused to the health of the kings and queens of England. Charles II died following an apoplectic fit despite, or because of, being subjected to various treatments such as bloodletting, purging, blistering, and cupping. Smoking and obesity, which remain modern-day problems, were also an issue for England's monarchs. As a young man, Henry VIII was fit and athletic, but a jousting accident severely hindered his ability to exercise. He developed leg ulcers, started to overeat, gained a lot of weight, and probably developed diabetes and hypertension. At the time of his death, he weighed about 178 kilograms. His body mass index rose to 50, shortening his life expectancy by up to 10 years. George VI was a heavy smoker, and as a consequence he developed peripheral vascular disease causing intermittent claudication, lung cancer, and coronary artery disease. In 1949, he had an operation called a lumbar sympathectomy to relieve a blockage in an artery in his right leg. His left lung, with its malignant tumor, was excised in 1951. After the war, cigarettes were cheap, widely advertised, and readily available. It therefore wasn't surprising that George VI smoked. At the time, Britain had the highest prevalence of smoking in the world. 2 years after King George VI died, Oxford academic Richard Dahl showed that lifelong smoking reduced life expectancy by 10 years. The exhibition also shows the dramatic effect of overtreating Charles II, precipitating his death. Having access to a physician in the 17th and 18th century was probably a terrible idea. On Monday, February 2nd, 1685, Charles II gave the dreadfulest shriek and developed convulsions, pallor, and speechlessness. Charles II lay dying. His physicians held his teeth open to stop him biting his tongue. They removed pints of blood by cutting veins open and by cupping. They gave him emetics and purgatives. They shaved his head and applied blistering agents. When more bleeding and purging failed, they gave him extract of human skull. They forced down his throat herbs, animal extracts, and tonics. Despite, or because of, their ministrations, he died on February 6th, apologizing for having been an unconscionable time dying. The cause of his illness is unknown. Possibilities include Bright's kidney disease, high blood pressure, and gout.